Hello everyone, my name is Dana. I'm a nurse here at ICAM, Institute for Complementary and Alternative Medicine, and I'm here today to talk to you about ozone. Ozone is a powerful regulator of the immune system. It calms down an overactive immune system in the case of autoimmune disorders, and conversely, it actually will boost an underactive immune system in the case of cancer, HIV, or any other chronic disease or condition, chronic infections as well. Ozone does so many things. It detoxifies cells, cleanses the liver, it decreases inflammation, it improves circulation, it kills bacteria, viruses, fungus. It also kills cancer cells. It helps build muscle, it enhances the memory, it increases the antioxidant protection within our own bodies, more so than even vitamin C. And one of the most fascinating things for me, being a nurse and having a background in science, is that it increases the mitochondrial energy production, which, if you look at that on a cellular level, our bodies are filled. We have billions and billions of cells in our body. So on a cellular level, ozone actually increases energy production, which to me, I just find profound. There are many plays that ozone is basically the most powerful natural vaccine that you can give yourself. So you rewind that part, right? Okay. There are multiple administrations of ozone. One of the most common is called MAH, or major autohemolytic therapy. This is basically just introducing ozone into your blood. The blood, it's not direct ozone, it doesn't go directly into your bloodstream. Some of your blood is removed in a sterile, closed circuit system, and then we introduce the ozone to that, allow it to attach to the red blood cells, and then by gravity it just re-enters your system. 99.9% of the time when we're doing major autohemolytic therapy, we are also using ultraviolet light. Ultraviolet light has over a 100-year history. There's a Danish physician that actually received a Nobel Prize in the early 1900s for proving the effectiveness of ozone on treating infections. Ultraviolet light has many, many benefits. It basically will improve the function of what blood does within our body, everything that blood does within our body. So it improves the oxygen carrying capacity. It improves our cell count in our blood. It normalizes clotting. It decreases the viscosity or thickness of the blood. And it also helps to increase the volume. Ultraviolet light also inactivates bacteria and viruses and decreases the inflammatory process. So you can just imagine major autohemolytic therapy, or IV ozone, in conjunction with ultraviolet light, is very effective in treating many conditions and disorders, infections, autoimmune diseases, cancer. It improves circulation for diabetics. I mean, the list is truly endless. Another route of administration for ozone is high-dose ozone treatment, or hyperbaric ozone therapy, which Mark has lovingly termed hot ozone. If you try to research hot ozone, you won't find anything on the internet, unfortunately, because, like I said, it is hyperbaric ozone treatment. Now, the difference between the high dose and the original regular MAH or IV ozone is that the high dose the goal is 10 passes. It is under pressure, and therefore the ozone will attach not only to the red blood cells, but also to the plasma. And it is able to get to places within the body where the circulation is minimal. There are studies that are currently underway in Europe that are attempting to prove that high-dose ozone treatment does instigate the body to produce more of its own stem cells. The high-dose ozone the effects of the high-dose ozone on a cellular level will continue on for up to 7 days after one treatment. And there are probably only, I believe, that there are less than 20 doctors in the United States of America that can offer this high-dose ozone treatment. One of the things that we like to add to our ozone treatments is chelation. So sometimes this may be referred to as chelozone. So chelation therapy in conjunction with the ozone helps to increase the detoxifying effects of heavy metals, as well as reducing the risk of cardiovascular disease and even improving cardiovascular function. Other routes of administration are injections. These are very popular here at ICAM. We do sinus injections for patients who maybe they're colonized and experience frequent sinus infections due to working in the medical industry, or some people are just exposed to mold. Some people who just have allergies, but this sinus injection is painless and it is very effective in improving the function of the sinuses. Another injection that we do here is called Prolozone. And what that is it's a homeopathic remedy mixed with ozone that is injected into either joints or soft tissue. And this would be very beneficial for people who have joint conditions, chronic pain, whether it be soft tissue, which would be considered muscle, something other than a joint, or the joint as well. And this actually promotes the stimulation of the natural healing processes within the body, as well as reduce the pain that people experience with these sorts of conditions. Some additional routes of administration for ozone would include rectal ozone, vaginal ozone. These are two of our most popular. Many of our patients purchase their own machines for home, and we educate and train them on how to use this method to experience the greatest benefit, whether it's for preventative reasons or for a disease process. Regardless, it is Mark believes that everyone should have a ozone generator at home and have the ability to apply it in these ways, if not to treat disease, to prevent disease from occurring. Bladder ozone is another procedure that we do here in the office. We can train someone to do it at home as well. It can be used for patients who have bladder cancer, overactive bladder. We have patients who have MS with overactive bladder. We can use it for prostate cancer, prostatitis. It is a very effective treatment. And then the final route that I'm going to discuss is the limb ozone, also known as bag ozone. And this is a wonderful, very effective treatment for patients who have infections in their limbs. So let's say we have a diabetic patient who has a wound in their foot, and being diabetic, they have poor circulation, they have poor healing capabilities. The ozone can treat any wound and help it to heal more rapidly. It can also kill off infections that may be in the soft tissue, and also osteomyelitis. It is one of my favorite routes of administration because I can see the results, as opposed to the other ones, they're more invisible. I just want to also mention that when I talked about the hot ozone, I had talked about how the effects of the ozone on a cellular level may continue on for approximately 7 days. For the regular ozone, the effects of that ozone being in your system on a cellular level may continue for 72 hours.